Good evening, Dr. Krishna Reddy.
Good evening.
So today we are going to have this conversation with Dr. Krishna Reddy Nallamala. He's a very reputed healthcare professional in Hyderabad, and he's going to talk to us about COVID-19 third wave. But before we start the conversation, here is a brief profile of Dr. Krishna Reddy. So, Dr. Krishna Reddy Nallamala is the country director, Access Health International, a think tank in health systems. He is building in order an institute for health systems strengthening. He is a leading cardiologist and has co-founded Care Hospitals, a large hospital chain with presence in 6 states. He has a long list of accomplishments, but I will be very quick because we got a lot of ground to cover. He founded Healthcare Services Group that is currently evolving into a model healthcare provider system. He was responsible for development of India's first cardiac stent, named as Kalam Raju stent. Dr. Krishna Reddy founded Relicis Medical Devices to carry forward the legacy of self-reliance in advanced medical technologies. He is on the board of trustees of US Pharmacopoeia. So that is Dr. Reddy's brief profile, and he is going to talk to us about third wave COVID. So doctor, tell us, is this true and how much of it is hype?
One thing is true is most of the pandemics have multiple waves. So by that context, the third wave or fourth wave are possibilities. But the prediction is based on certain known things and certain unknown things.
Okay.
So one of the known thing is what percentage of our population has immunity.
Right.
So recently we got the publication from ICMR, the nationwide study, that showed that 2/3 of Indian population have a seropositivity. That means they acquired immunity either through a natural infection, silent or manifest,
Okay.
or through vaccination. So this is one figure that we have, that 2/3 are protected, but 1/3 are vulnerable. That means 40 crore people are still vulnerable.
Okay.
The second is the emergence of new variants. That is a reality as long as the virus replicates across the globe, not only in India, but across the globe. The new variants keep coming in. So if the new variants come, how they are going to behave in terms of immune evasion. That means if the new variant evades the existing immunity, then this 2/3 immunity does not make a difference. For example, the new variant that is emerging in Peru called Lambda variant,
Okay.
that might evade the existing immunity in other countries. So that is the second unknown thing that will determine what is going to be the third wave. The third thing is how long this immunity is going to last.
Okay.
After infection, now we have at least evidence up to 1 year. The reinfection rate, even at 1 year, is less than 5% across the globe. So that is a good news that at least up to 1 year post-infection, the immunity is lasting. Similarly, after the vaccine, now we have only experience of 6 months.
Right.
So how long this immunity after vaccines will last, that also has to be observed. So given these 2-3 unknown things, we should expect a third wave.
Okay.
More than expectation, it is always better to prepare for the worst case scenario.
Right.
If it does not happen, we are saved and we can be happy. But if it happens, we can prevent unnecessary suffering of the people.
Right. So there have been these news, announcement by, I think, AIMS director. August mid was the likely tentative date for the third wave to hit. What do you think about that?
See, the predictive models require much more granular data.
Okay.
Than what we have. But in real life, what we can look at it is the rate of decline. See, we have been noticing for the last more than 1 week, 2 weeks, that the rate of decline has almost flattened. That is a worrisome thing. If you look at Kerala, I mean, the last few days, there seems to be slight actually uprise, both in terms of the positivity rate as well as the numbers. So these are the earliest warning signals. I mean, people have to be aware of and closely watch the clinical behavior, epidemiological behavior, and also the genomics surveillance, whether any new variants are emerging in Kerala and Maharashtra or any other country where there is a spike.
Right.
So predicting mid-August, I mean, it is, I won't say that we are in that position to accurately predict when the third wave is going to be.
Okay.
As I said, we don't know many unknown things, and there are many unknown things. In the situation of many unknown things, even if you use most sophisticated models, the prediction may not be accurate. So there will be a lot of variability in prediction. But as I mentioned, it is better rather than more predicting, spend energy more in preparing ourselves for the third wave, whenever it happens.
Right.
After the tsunami, our disaster management got prepared for the next tsunami.
Correct.
May not happen in the next 10 years, but that preparedness has made us much more resilient against other cyclones. Recently, you saw the less number of deaths in the Orissa cyclone. So that preparedness itself is good enough to prepare even for other epidemics and the pandemics. Like you saw the reports of Zika virus in Kerala.
Yes.
Yeah, so unless that preparedness is there, so more than, I think, debating on whether third wave will come or not, the debate should be on, is the system prepared? Did we learn from the past 2 waves?
Mm-hmm. Absolutely. Right. Now, this pandemic is of such a big magnitude that obviously it calls for participation from all levels. So I would see that there are three basic stakeholders. First is the government. Second is the healthcare professionals, doctors like you, researchers. And third, of course, the common public. So maybe you could tell us in three sections what the doctors should do. And of course, we also know that you are a policy maker, not just a healthcare professional. So maybe the second can be about what the government should do, perhaps taking examples from abroad. And third is what people should do. So let's start with what do you think doctors should do to prevent, what kind of preparedness?
From the doctor's point of view, preparedness is in terms of provision capacity. Like at a short notice, how you can convert the existing beds into COVID-specific beds. And whether your system in the hospital or in your clinic is geared to take all the precautions not to increase the spread. The third is, if you are in a hospital, whether your hospital is actually stockpiling essential drugs and the diagnostics.
Okay.
Including, do you have secured your oxygen supply if there is a need for it? So the fourth is, as a doctor, we continuously see our patients and their families every day. So every time we meet a patient, two things we ask. One is, you should not let down your guard in terms of the face mask and the sanitation and social distancing.
Okay.
Second is, we ask whether you are vaccinated.
Okay.
So this is only to use that opportunity, because that will be much more powerful in influencing people's behavior and altering their hesitancy against the right. So as a doctor, these are the things that we should do. Then thirdly, we are continuously watching our medical literature, because the information is coming so fast. So we have to be up to date to discard the drugs which are proved to be not effective, not be only sticking with the drugs. Then understand even the limitation of some of the tests in the face of new variants, and be updated about the immune evasion of some of these things, and be updated about the various changing clinical manifestations of new variants. Are they requiring more oxygen? Are they requiring more ICU stay? Are they requiring more ventilation? or do they manifest with multi-organ dysfunction? So as a clinician, these are the things I think we should be prepared for any next wave.
Okay.
Coming to the governance system.
Yeah.
It is not. So I look at the governance system right from the local governance in a village level in a village, or a ward level in a city.
Right.
Then come to the district level, then the state level, then the national level, and the international level. This pandemic is global, so we have a governance responsibility, and the type of response varies from each governance level. For example, from a central government perspective, the key responsibilities the government is looking at is now, if you I think recently news, 2-3 things I came across. One is allocation of special fund for the phase 2,
Okay.
preparation for the next wave, creating more ICU beds, especially more pediatric beds, because that is the vulnerable group. Securing the oxygen, because every district hospital at least should have the PSA.
Right.
And allocating funds for the genomic surveillance so that we are detecting any new variants at the earliest point of time. And allocating more funds to the NCDC, the National Center for Disease Control. So, because that has to be strengthened to have a more robust surveillance system.
Right.
And the surveillance system need not be in the traditional way. If you have information from the diagnostic labs, if you have information from the pharmacies, any uptick in the COVID-specific drugs or any uptick in the COVID-specific diagnostics should alert a particular geography where it is coming in. So that is one preparedness at a central level. The second preparedness at the central level is in terms of the social security net, because we are focusing on the medical aspect of it, but on the social aspects of it, on the financial aspects of it, of the vulnerable people, that is a responsibility at a national level and at the state level, whether there is any social security net.
Right.
The third is at a district level, having a clear assessment of what is the capacity of the whole system, not just the public healthcare system. When you say governance, it is responsible for the entire health system, both public and private. That means a district collector should have at his fingertips how many beds are there in the district, how many doctors are there, how many nurses are there, how many critical care doctors are there, how many doctors can manage the ventilator, how many ventilator beds are there, how many dialysis beds are there. I mean, it does not take about 3-4 days time deploying its manpower to gather this information. Then you can have a simple modeling, like what was the last peak in the second wave. At a national level, we had 400,000 in a single day, right? So that you dissect it at district level, you have the district level data. So for that peak surge, is the capacity sufficient?
Okay.
If it is not sufficient, can we engage the private sector into the pool and make it sufficient? So these are, I think, simple steps of preparedness in terms of infrastructure capacity.
Right.
The third thing is, most important thing is the communication. Communication, both direct communication and indirect communication.
Okay.
Because how the political leadership, how the policymakers behave in the public. If you are conducting rallies without masks,
right,
conducting mega functions without any social distancing, while you are sending messages in the WhatsApps and the mails and everything that you should maintain COVID appropriate behavior.
Right.
See, the elected representatives, people are looking up to.
Good.
You be the change that you want to bring in the people.
Right.
But if you are behaving like that, I mean, people will follow you.
Yes, ironically, a COVID awareness conference will have half the people not wearing masks or, right.
So these are the things I would say at the governance level.
Okay.
At a people level, I think people are equally responsible. I mean, the moment the lockdowns are lifted, you see people, the memory is so short. I mean, you cannot justify by COVID fatigue or whatever it is.
Okay.
It does not take much time to keep wearing the mask. In fact, it prevents against pollution. It prevents other respiratory infections or other flu infections. You don't have children are not having acute asthma attacks because they are not exposed to pollution, the respiratory infections. So why not make a face mask as a routine public health measure?
Absolutely.
Not just for the COVID.
Yeah.
So if people are not responsible, naturally the representatives which these people elect will be similar to, they are reflections of the people.
Right.
So, and the response, you have seen the models in villages, some of the villages, how they took the governance into their hands and they responded in an adaptive fashion at a village level. In fact, if the village is prepared and trained to respond to any epidemic, not just the COVID epidemic,
right.
On basic things of isolation, allotting the school for, because we don't have luxury of multiple rooms to self-isolate in the home.
Right.
So how a village panchayat can prepare the school ready for isolation of patients when they're infected, so that other family members are not. You have seen in the second wave, one family member is positive, everybody is positive within 3 days.
Right.
That was the degree of transmission. So these are the three types of responses. I would say everybody is equally responsible. Each one has a certain responsibility and role. The state should not criticize the center. Center should not criticize the state, and the state should not criticize the district. So each one, I think, should define their own roles and then act appropriately.
Right. One thing that really stood out, especially during the second wave of pandemic, was the rising cost of treatment. Any person you speak to, your neighbor in your apartment, a colleague, they would always say, like, we spent 8 lakhs, we spent 12 lakhs, 16 lakhs, we had to sell a property, we had to take a personal loan. So what do you think? What kind of insurance solution would somebody like you from Access perhaps recommend the government on this?
Yeah, in fact, bigger failure than the medical control was the financial failure.
Right.
Especially on the health protection failure. The health insurance, which is supposed to protect against this type of crisis, people were not approved when they wanted to get for COVID admissions. Hospitals declined by whatever reason.
Yeah.
So some of the state governments did not include COVID treatment as a part of their health protection schemes. The
right.
net result was that people who are, even those limited people, if you take now currently PMJ, RVC and everything, private health insurance, we have almost 40 to 50% population coverage. But if you really go into the field and ask people how many actually got the protection. So we should not lose this opportunity, learn from why this system failed. The insurance system failed. That is one aspect of the insurance protection for those who are actually insured. Those who are not insured, it was horrible. Because they didn't know what actually was going to hit them. We could see as doctors, in fact, the patients were more scared and terrified of the likely bill than the disease itself.
Absolutely.
So given these two things, I think
yes,
there's an urgent need. One is to relook at the insurance model and what went wrong and fix it immediately. The second is there may be a case for a price regulation because health is an essential service. So you have a price regulation on the drugs. If you have price regulation on essential diagnostics, because you can easily rationalize why it should cost that much. Because there are scientific guidelines. So if you are inappropriately using high-cost antibiotics, if you are inappropriately using high-cost diagnostics, or you are loading the PPE cost in an unreasonable fashion compared to the cost. So there is a need. There will be definitely a strong pushback by the system against any price regulation because the market is supposed to regulate the price. But when the markets fail, an essential subject like health, you cannot treat it as like any other service. So you need to come down on that. The second solution that in fact, some of the European countries adopted was that you make public the private hospitals for the temporary period of COVID surge. That means you take over the hospitals, and then you provide free service. You pay the private hospital owner what is losing by making public during that period. So there are, I think, multiple solutions to protect. In fact, the insurance companies, because most of the non-COVID diseases, people were not seeking that. In fact, they are surplus money. The claims ratio actually dropped significantly. In the
Right.
West, some of these insurance companies, what they did is they made advances to the empaneled hospitals equivalent to what the claims were last year, so that hospitals actually can handle their cash flows. Because one of the key challenges the hospitals were facing was the cash flows.
Right.
Yeah, these were, I think, there is a great need for relooking at the entire financing mechanism for health protection. The second financing mechanism for the social protection. I mean, luckily, the direct transfer of money to the accounts because of the Jan Dhan accounts, it did help, and also delivery of essential rations goods, especially the food items. It did help.
Right.
And also the NREGA in terms of the rural unemployment, it did help to the migrant laborers. So these were some of the positive lessons actually. I mean, they need to be more strengthened, especially when the migrants are in the cities and they could not acquire or access the rational goods and the benefits which they were acquiring at their state level.
Right, sir. Absolutely. I mean, the insurance one was something that I think everybody wanted to know. So, if you had to give the government maybe 2 points to work on, starting now, we are like almost mid or end of July till say mid of August. What are the 2 key points you think they should immediately work on for a better situation?
Ensure that the capacity is prepared for. I think that is the first thing. So capacity, in case surge happens, is there a capacity, and be prepared for that. And the second is micro containment. I think at the district level, collectors should be made responsible and be decentralized. They should be empowered to take decisions in their district or even the sub-district level. Any spike to come down heavily on containment measures. I think these are the 2 things from a perspective of handling the third wave.
Okay, all right. And for people, you said, of course, still maintain social distancing, mask, building of immunity.
Yeah, that is until the last case. I mean, until the WHO declares that the pandemic is over across the world, not in your city or in your village. So that COVID appropriate behavior until there is a declaration globally that the pandemic is not a health threat to the public.
So would you give that kind of a situation another 6 to 8 months? Going by the current situation now, do you think in, let's say...
I will be as good as an astrologer if I start predicting. It is a dynamic, evolving situation. I mean, my approach is continuously watch every second, every minute, what's happening, what is evolving, what information is coming, and respond in a dynamic fashion. Don't predict and then do too much of that prediction.
You had mentioned the word fatigue. I mean, like whatever, mask fatigue, social distancing fatigue. So how does one seriously, like you mentioned, after a point of time, we were like, okay, now I'm done with this. Abhi kuch bhi hone do. How do you, like, I don't know, is there something that we can tell ourselves to get out of this fatigue?
See, I have been seeing my patients without interruption throughout. Okay. So I'm having normal social life, but I'm only ensuring that I have a mask and I wear double mask in a closed space in a meeting or something, and I'm washing the hands. So my social life, and I'm convening as many meetings as possible. So as far as social life is concerned, as long as, even if you're going to a trip, to a resort, even there you can follow some these simple measures, but still enjoy life. So you don't have to, sacrifice your life. So it's the attitude. I think the attitude and the discipline, the personal discipline and the attitude. I think people can still live normal life as long as they just tolerate some of these minimal inconveniences.
Right. I think it's a bit like seat belts. Today we feel there's something wrong when we start the engine without putting on the seat belt. because it's like on autopilot we do that when we drive a car or we put. I think we should also treat the mask on similar lines and go ahead with making sure we
once
wear
it is made a public health measure, I mean, a lot of innovations will happen. That means mask will not be visible actually. I mean, your face. So there will be a lot of innovations, and there will be a mask which will allow you to breathe, a mask which will allow you to eat.
Right.
So if it is made a public health, I mean, see, you see the innovations in seat belts, airbags, and other things, helmet.
Yes.
Same innovations will happen. Already we see the fashion also in masks actually, old masks and other masks.
Yes. Yeah. But I hope instead of having those amazing masks, we will have a time where we don't have to wear a mask, where we are completely conquer the pandemic.
No, even if you conquer the pandemic, I mean, every year enough number of people are dying because of ordinary respiratory infections. There are enough thousands of millions of people are dying because of pollution.
Okay.
So, in fact, I wrote earlier also, mask should be like a condom for HIV. I mean, the mask to prevent respiratory illnesses is equivalent to condom to prevent HIV. So it's as important as that. In fact, I won't wait for COVID end actually. Let it be continued. Improve the mask, make them more fashionable, make them more comfortable.
Okay.
Some status symbol.
Right. Mm-hmm. Nice. I think we've covered a lot of ground. We discussed what each one should do, what policies we should have, what the government should do, managements, and like you said, better masks, fashionable masks, more practical masks. Is there? I think we got a couple of minutes before we wrap up. Any other concluding thoughts, Doctor, before we end the conversation?
This lesson that we are having from COVID pandemic in terms of how to strengthen our systems, the entire health system across the country. This is the right time because this is in the top of the political agenda, policy agenda. Public want government to do something. Governments can win next elections based on the healthcare. So this is we should not miss the bus to fix our health system, right from the primary health care to the most advanced care, rehabilitation, palliation. So there is a need to strengthen the health systems. Only when you strengthen the health system, then you can secure the people's health. I mean, we spend a huge amount of money to secure the borders. But when people are dying within the borders, we need to spend more money to secure people's health. So, my take-home message is that don't be happy that COVID is over. Don't miss the opportunity to learn from this experience. If the country cannot learn from a mistake, it is no future.
Right.
So that's my message, that let us learn and fix our system.
Right, absolutely. We hope that all people who haven't and who've tuned in have sort of got the message. We all have been thinking, ho gaya abhi mask, we'll throw it out and get back to lipsticks or whatever was fashion, But I think it's too early to celebrate or think on those lines. Let's be prepared for the pandemic in every single way. So those of you who still want to connect with Dr. Krishna Reddy Nalamala, you can certainly do that on his Facebook page and Access page. I don't know how to see the question actually. For some reason, I'm not able to check.
Can I just read them out here?
Are we?
Yeah. Can I? There is one question. Can I just read it out?
Yeah, go ahead.
Satya asks, will more self-conscious people make a better health systems in India?
Yeah, I mean, every citizen has to become self-aware. It is not just the government role. I mean, that is what my personal belief. It is everyone's role to make health system strong. Because if people don't follow healthy lifestyles, whatever health system you invest in, it is a bottomless pit. I fully agree that people have to be conscientious about their responsibility to strengthen the health systems.
Okay.
Any more
Where else can where can they get in touch with you, doctor, for any other queries? I mean, are you available on? I mean, I don't know, you're a busy doctor, but where else can people get in touch with you?
No, one is I think we have the In Order website where the queries can be sent, or Access Health website where the queries can be sent.
Okay.
Of course, I have my email which I respond. I'm not a social media savvy, so
Okay.
so
But you did.
the mails I respond well, and sometimes the WhatsApp messages, if they don't bother me too much, I respond. I try to control technology rather than technology controlling me. But people are, welcome to ask questions.
Okay.
Ma'am, I have sent some questions on your WhatsApp which are coming on Facebook Live. You can read them out from your phone.
Right. So every after this, Dr. We have a couple questions here. No, I can't see the questions.
Ma'am, you'll have to go
Where
to
did you send
WhatsApp? Ma'am, WhatsApp.
Oh, okay. Just please stand by for a couple of minutes. Unfortunately, I can't see your questions. Maybe you should. Oh, yeah, got one. It's a. It says. Is it true that children are? So somebody is asking. Uma Isola is asking. Will there be a fourth wave? I hope not. But Dr. Krishna Reddy is the right person to answer.
No, as I mentioned, the nature of any pandemic, until it is controlled, there will be waves continuing, because as long as virus replicates, the mutations will happen. As long as the mutations are there, new variants will come. As long as the new variants come, they will have advantages. So, but the severity of the waves will slowly come down, wherein the pandemic becomes more like an endemic disease.
Okay. And one question is about children are still not vaccinated, children below 18. What is the solution for them? I mean, they are actually the demographic who should be out there playing athletic and all. What is the solution, doctor, for them?
In terms, because the children, as of now, we have vaccines which have been validated in children above 12 years.
Okay.
And vaccines are being evaluated less than 12 years as well. The idea was to first vaccinate the most vulnerable people, most high-risk people.
Right.
Fortunately, COVID was much more milder in children. But it's not that children should not be vaccinated. Children will be vaccinated. It's only awaiting the safety data and efficacy data. And more importantly, the demand and supply. So globally, when you have limited supplies, you distribute those limited supplies to the most high-risk people first.
Okay.
So it's not that children will not be given vaccines. When you have enough supplies and you have enough evidence that children are safe to be vaccinated, they will be vaccinated and they should be vaccinated.
Right. And somebody is asking a question saying, how do you rate our health system as compared to the West? With so much of criticism on our health system, our system with the West.
Yeah, so it is challenging thing to compare apples to oranges because West has its own problems specific to their population in the health system. For example, when you look at the US, they're unable to sustain the financial cost of their health system. It has reached almost 20% of their GDP. So most of the Western nations are finding difficulty in terms of the rising cost, which is outpacing the economic growth of that country. So that is one challenge with the West faces. The second challenge the West faces is the waiting times. Because for most of the elective requirements, for ordinary things, when you compare, say, India, if somebody wants to see a specialist or somebody wants a joint replacement next week, they're able to get it, despite the most weak system. But the same joint replacement in the UK, it might take 1 year waiting list. So, there are multiple, but ultimately what makes the difference is, are your people healthy? Are they suffering? Naturally, when you look at health indicators, we are not healthy as a population. On all health indicators, even among the low-income groups, we are not healthy as a population. That itself, I think we should more focus on that rather than compare with the West.
Right. One question from Srinivas Reddy Bendaram. It says, I want to know, do we require a third dose of COVID vaccine to handle the third wave?
No, the third booster dose, I mean, one is, as I mentioned, we don't know the duration of protection by the existing vaccine. So as the evidence is mounting, if there is an evidence that protection lasts only 9 months or 12 months or 18 months, then you require a booster as per the duration of protection.
Okay.
The second is if the new variants require a more robust immune response to protect, that is when the third dose may be required. The third scenario is people who have an inherent immune deficiency. That means either they have an immune deficiency disorder or they are on immunosuppressive agents. Like most of the autoimmune disorders, people will be on immunosuppressive drugs, post-transplant patients. So some of these patients who are vulnerable, that means they are unable to mount an effective immune response. So now people are recommending only for that group of people in case they are unable to mount adequate response, as evidenced by no antibody levels in their serum despite 2 doses of vaccination. A routine third booster is not yet recommended as per the guidelines because evidence is insufficient. And more importantly, there are enough people who are not received even the 1 dose. Forget about the booster dose. So I think they require the limited vaccines more before the third booster dose.
Right, absolutely. And this is a question from Anuradha Katyal. She says, does a disease like COVID actually suggest that insurance should rethink excluding infectious diseases?
Yeah, there is a lot of thinking is needed in the insurance segment. How they are covering, what diseases they're covering, what health needs of the people that they were covering. Though we thought infectious diseases are behind us, they are not behind us. They are going to be there, and they are going to be equally challenging as non-communicable diseases. The antimicrobial resistance is expected to kill 14 million people by 2035 if we don't address the antimicrobial resistance. So I think there is a need for rethinking on what the insurance should cover and what it should not cover.
Okay. All right. Do you have a couple of more minutes, Doctor? We have two more.
Yeah, we can go ahead.
Okay.
If it benefits the audience, it is fine.
Right, yes. So this question comes from Tushar Mokshasi. The question is, what is the likelihood that states or union territories like Delhi, where some districts have more than 60% people partially vaccinated, will experience a strong third wave?
As I mentioned, the probability of third wave, for example, the Delhi Sero survey, if you look at, the sero positivity rate in Delhi was 82%. So, which means there is already herd immunity as far as the current variants are concerned. That is Alpha variant, Delta variant, and the original code. So, Delhi may not witness the similar degree of third wave because of the high level of sero conversion. The only situation where it can witness a third wave, for example, a variant like Lambda seen in Peru comes to Delhi and it evades the existing immunity. To answer that question, I think, partial vaccination gives you varying from 40 to 60% protection. Full vaccination protects you from 60 to 80% protection. But your face mask protects you almost 60 to 70% against any variant. Forget about it.
Okay.
So face mask is much more effective in preventing infection, whereas vaccine is much more effective in preventing illness. So please note the difference. The vaccination may not prevent infection. It prevents illness from developing a post-infection, whereas mask prevents infection. So they are not mutually exclusive, or they are complementary. And mask does not differentiate a variant, whether it's lambda, kappa, or whatever variant, it protects you. Whereas vaccine may not protect all the variants. So highlighting the advantage of mask over the vaccine actually.
Right. You're completely for the mask. And this question I think you've answered, but I'll read it out. It comes from Arun Bhatt. Says, sir, when should one take third dose? Is it required first and second dose? How long it will save us? I think you sort of.
Yeah, the point I asked, at least Arun Bhatt does not require the third dose for his risk assessment level.
Right. Absolutely. So I guess those were some of the questions that
just related to that, because a lot of people are getting their antibodies tested. So third dose recommendation is not based on antibody levels, because you have what is called memory B cells. Even if you don't have circulating antibodies, the B cells will kick in the moment they face a virus. And you also have T cell response protection. So antibody is only a surrogate marker. You may have a deeper immunity protection. So only solid evidence will be what is the clinical behavior based on the duration of post-vaccination period.
Okay. All right. So I guess we've covered a lot of ground. Thank you so much, Dr. Krishna Reddy, for taking time out.
Yeah, thanks,
to do this session for the benefit of our, viewers. Yeah, I'm going to face this thing. So those of you who have questions after this, please do get in touch. Thank you, Dr. Krishna Reddy. Thank you, Stuti, for making this.
Yeah,
we hope to keep
thanks
in touch
for having the patience to ask the questions.
Pleasure. Okay.
Thank
Bye-bye, everybody.